Hello and welcome to another episode of the Iraqi Nutrition Podcast. I'm your host Juma Iraqi, and joining me today is Dr. Cassandra Forsythe. Cassandra, how are you doing today?
I'm good. Thank you for having me.
Thank you so much for agreeing to do this podcast with me. And today's topic is, we're going to talk a bit about IBS and FODMAP. But before we go into the questions, could you please give us a short introduction about yourself?
Okay, so I have my PhD in exercise science or kinesiology from the University of Connecticut. I graduated in 2009. And prior to that, I did my master's in human nutrition and metabolism and my bachelor's in nutrition and food science at the University of Alberta in Edmonton, Alberta, Canada. I'm a registered dietitian. I have written 2 books, The New Rules of Lifting for Women and The Women's Health Perfect Body Diet. And I'm also working on another book right now for Women's Health magazine. Should be out in the fall. I'm an advisory board member and writer for Girls Gone Strong. I have a daughter. I live in Connecticut, and I love to lift weights, and I hate to run.
Interesting. So you have your plate full.
Yeah.
Now, how old is your daughter?
She's 6.
She's 6.
Yeah.
She hadn't got into lifting yet.
So I used to own my own gym.
Okay.
So I did that. I just sold it last year because I'm back now full-time academia. I'm teaching as an assistant professor at Central Connecticut State University in the exercise science department. And when I ran my gym, she used to come with me all the time, and she would lift kettlebells and swing her own little kettlebell and do deadlifts with chains and jump over barbells. And so she's a very active little girl. Yeah, she's fun.
Good mom then.
Yeah, teaching her well.
So, what got you interested in the topic of IBS and FODMAP?
All right. So I've had a long history of gut issues. So even as a child, I was always constipated and always had gas, and it was just really annoying. And I once I got into natural medicine, I learn about probiotics and about changing your diet to make your gut happier and healthier. And I finally discovered that, if I changed things about the way I ate, it influenced my gut. So, if I didn't eat this, I didn't have gas all day long, or bloated, or wasn't constipated for several days in a row. So always struggled with, what foods to eat and not eat. And then and I was on some medications for IBS. I don't remember the name at the moment, but back in 2004, I started some medications for IBS to try to give me more regularity in my bowel movements and whatnot, and also calm down the inflammation. And then discovered in 2005, I started getting rectal prolapse. So rectal prolapse is where actually my intestine was coming out when I'd go to the bathroom. It was really weird. And I went to my GI doctor who was prescribing my IBS medications, and he said, yeah, that's not supposed to happen. I didn't really think it was. So we had to do a whole bunch of different type of tests, and we finally discovered that, yeah, okay, I have rectal prolapse. So they had to go in and remove a foot of my intestine. And that helped a lot. I mean, I started being a little bit more regular after the surgery, but I was in the hospital for 5 days. I lost 15 pounds. I had a huge scar on my gut, had to rebuild my core. And even when I finally, recovered from all of that, I still was having problems with foods. And then I don't know how I came across FODMAPs, like foods that cause, flatulence and can be constipating for some people or give diarrhea to other people. But as soon as I eliminated almonds, apples, I don't eat a lot of dairy. I never was a big dairy fan, but just really made sure I got out of whey protein and started using pea protein. Once I did the things, I took the foods out that were good, I've been normal, and it's been great. And I've really, sort of gone through that as a very long journey, because I've been to so many doctors and they're like, oh, just take a probiotic, or take a digestive enzyme, or take some hydrochloric acid. And none of that ever helped until the food was this part that solved it all. And so I started writing about it in 2010, and it's just blown up. And there's so many people, talking about FODMAPs. There's books. I actually got asked to write a book about FODMAPs, and then they found another writer, and I was like, that's fine. I'm pretty busy right now anyway. But, there's a big interest in it because it does work. And I get emails all the time from people asking, is this okay? Should I eat that? And it's very individual what someone should or should not eat, no matter what. But this seems to be a really good approach for people that have any type of gut problem.
Yeah, and like you said, it sometimes can be difficult to distinguish IBS from other diseases. So,
Yes.
as a starting question, could you please just describe what IBS is?
Well, IBS is this term that doctors will give irritable bowel syndrome to individuals where they don't really understand. They aren't diagnosed with Crohn's. They don't have necessary colitis, or they haven't diagnosed that yet. And they give them this term that can refer to having a lot of gas with foods, or having diarrhea, or being constantly constipated. It's just a term saying your gut is not normal. It's irritable. It's not happy. And there are more like clinical terms to this, which I know you have a lot of knowledge on. You can describe more. But, in my experience with everybody that I've worked with, doctors are sometimes getting a little lazy, and they just want to say, we don't really know what's wrong with you. Here's a medication, or it's in your head, or whatnot. And they don't really go into like, hey, maybe it's what you're eating that's really irritating your gut. Like my ex-husband, he had Crohn's, which is a GI disorder, but it was all alcohol related. As soon as he didn't drink alcohol, he didn't have Crohn's symptoms anymore. Mm-hmm. So, there's obviously a connection to his gut. He got off all medication and everything just by not having alcohol. So, why don't doctors look more into that? So anyway, irritable bowel is a global term to say, we don't know what's going on. You're not normal, but we don't really know why you're not normal.
Excellent. And it seems to be a lot of people that get affected by this disease. I think it's 11% globally that gets affected by or diagnosed with IBS. But are there different versions of IBS?
Oh, for sure. You've got the diarrhea predominant IBS, where you can't hold your stools, you're running to the bathroom all the time, which may be a Crohn's disease issue. But with Crohn's, there's blood, and when they do a colonoscopy, they'll see a lot of red and inflammation. Then there's the constipation type. There's just being gassy and bloated all the time, in a sense too, that they'll call that. So there's a lot of versions of it. And you say 11%. I know you said you read a paper on that in 2014 that stated 11%, but I'd say it's more people than that. There's a lot of people that suffer from gut issues based on the amount of people that reach out to me via email saying, what has helped your gut? Does this work? Does that not work? It seems to be a lot more prevalent, or it's not being diagnosed. It's just people are unsure of what's going on with them.
Exactly. And I think like I mentioned to you before we started this podcast today, was that I used to work at a medical clinic a couple of years ago, and I would say that more than half of the people that I used to work with were gut related issues, and a lot of them were IBS, and sometimes turned out that people was misdiagnosed. They were told that it was IBS, and you did some stool work and some blood work, and you found out that it wasn't. It was ulcerative colitis or Crohn's, that are inflammation diseases and sometimes require really strong medication to treat. Right. I know that they used to have term IBS as an exclusion diagnosis, where you have to eliminate all the other diseases before you could tell people that you have IBS. But I know that in recent times they've started to use certain criterias to give people diagnosis. Like you've had to had 3 days, at least 3 days a month with abdominal pain. You've had to had changes in the looks and the frequency of your stool, and if you've had to had at least, I think it's at least 3 months with these symptoms. So if you have the stomach pain and 2 of the other criterias, and another one is actually that you feel better after going to the bathroom. If you have 2 of those symptoms, you will be fulfill the criteria to get diagnosed with IBS. So I was really interested when I first heard about FODMAP, and I started actually to use it with clients and saw huge improvements with a lot of my clients. But I remember still that a couple of doctors were like, now it doesn't have to do anything with food, it's all mental, it's all in their head, and usually they have depression, and the depression is causing, or depression and anxiety, and the depression and anxiety is causing the GI disorders. But I often used to question this, that is the depression and anxiety coming from the disease itself, or is it going the other way? What do you think about that?
Well, I mean, I have depression in my life, and I wouldn't necessarily say that for me has ever been related to my gut. I mean, definitely. So if you have an anxiety disorder, I mean, it can cause, you're contracting through your whole body. So you could have diarrhea. My mom, when she went through a really stressful time, my nephew, so her grandson, was living in their house. And I mean, my parents are older, and just having a young teenager living in the house again was super stressful for her. So she used to have just diarrhea and always was going to the bathroom. So, I mean, it can be related. And as soon as he moved out, she was fine again, But I mean, you definitely have to, you can't just assume what all it is. I mean, that's why you have colonoscopies. You can look in and see if there's inflammation and if that's a problem. I mean, she kept thinking she had colon cancer, and that was the issue, but she's also a little bit of hypochondriac. So, but yeah, definitely, I mean, it can be short term, but if it's long term, I mean, people don't have anxiety and depression every single day all the time. It usually goes in waves. Yeah. So, that's not always the answer either. No. So, I mean, it can be, but it's probably not the only reason. And a diet does seem to play the biggest factor in your gut. I mean, you're putting food in there. What you're eating is going to influence what's going to happen down there. Yeah. So it is a little individual, but probably not only just depression, anxiety.
Yeah, I totally agree. And because I used to remember when talking to a lot of the people that I had as clients that used to have IBS, is that they used to tell me that the doctors used to tell them that it was caused by the depression and anxiety, because those diseases can sometimes give symptoms from the GI system. But what I experienced was that a lot of them used to actually have depression and anxiety coming from the disease itself, like coming from the IBS itself.
Right.
One of the things that they used to have anxiety about was that they would go to a place and they would have to use the bathroom, and there wasn't a bathroom there. So that caused the anxiety, and it was like this vicious cycle that kept going on and on. And so that seems to also worsen the symptoms. But let's get into FODMAP, because there's really good data on it that really shows that it worked. Could you explain what FODMAP is?
So what they are is they're fermentable carbohydrates, and it stands for fructans, oligosaccharides, disaccharides, monos, and polyols. And those carbohydrate chains that are like in high amounts in certain foods are fermentable, and so they'll feed the gut bacteria, the bacteria that tend to cause like methane gas or short chain fatty acids that are irritating to the gut, and they will cause someone to have either diarrhea or slow down the gut motility and cause them to have constipation, and then usually flatulence with that at the same time. And examples of those are apples, almonds, cashews, cauliflower, onions. Onions are huge. Beans, of course, I mean, because they've got the fructans in them. Dairy, wheat for some people. Interestingly, wheat doesn't bother me, but everyone also is a little different with all of it. But there tends to be very common foods for most people. Like, I would always say an apple a day would keep the doctor away, but only because you're so gassy. And apples tend to be a really big one. But there's the Monash Institute's an Australian research institute that does all the most work with FODMAPs, and they have a website that gives you a list of everything in full detail. They have a app for your smartphone you can put on your smartphone, and it tells you the red light foods, green light foods, what would be good, what not be good. But you still have to listen to your gut. Like maybe something that's a red light food for some people may not be for you. And once you've calmed your gut down, like I can eat apple pie every once in a while or have a little bit of an apple, but if I had like an apple a day, it would become a major issue. So say me once every couple of weeks, I'll have a bit of an apple, like especially during apple season, and they're just amazing, but not in high amounts and not frequent. So once your gut has calmed and been a little bit more rational to you, you can slowly introduce foods that may have been an issue in the past. And it's, almonds, for example, that's a big one that are in a lot of food bars right now. And you have to really read labels carefully and see if it's in there. Other things that are in common products like ital sugars, mannitol, sorbitol, all the alcohol sugars, those tend to be very irritating to the gut too. And they're in like any protein bar or sometimes in protein powders and meal replacement shakes. So you'll tend to get those in there. And also thickeners like carrageenan and xanthan gums. Those tend to be irritating to the gut as well, and fermentable. So you have to be careful. You have to really read labels, and you have to really pay attention to what's going on. And then it just becomes a habit. Like for me, I just know like what works and what doesn't work. And then you just go with it, and it makes a huge difference. I've had so many people find such relief, but you just have to be very diligent with it. Like garlic, maybe a little bit in a food one time, but don't cook with it because this can become a problem. Don't eat the onions in a meal, like pick them out, or don't order something that had onions, that kind of thing.
Yeah, great that you mentioned the thing with the sugar alcohols, because like. Many people don't know this, but at hospitals they actually use sorbitol as a way to increase fluid in the intestine. So when they do MRI scannings of the small intestine, they use that, so the pictures will be better, so they can look better at it. So you'll have to drink, I think it's 1 liter of sorbitol before the examination, and all this water gets pulled through in your intestine, and the patient will get a letter telling them that don't make any plans after the MRI scanning because you'll spend the rest of the day in the bathroom. So some people seem to be able to ingest a large amount of sorbitol without them being affected by it, while some other people seem to be really sensitive. So if you use, I remember I had a couple of cases where people have done like every scan and every examination imaginable for the GI system, and finally turns out that they're eating like 2 packets of sugar-free drops or gum during the day, and that's what's actually causing these problems.
Sugar-free gum's a big one. Gum in general, because you're absorbing air and the sugar that's in the gum, whether it's if it's sugar gum or sugar-free gum. I mean, it's a lot of that stuff's in there. Like they've got thickeners, xanthan gums, and stuff in there that your gut does not like. Gum is not good for people that have GI disorders.
There's actually a Norwegian study where they gave a sugar alcohol to half of the they gave sugar alcohol to one group that had IBS and the other group that didn't have IBS, and they did a MRI scan to actually see if there was a difference, and you could see clearly that the people with IBS had much more water drawn into their GI system compared to the people that didn't have IBS. But back to the FODMAP, do you feel that there's a dose response when it comes to FODMAP? Like you can, because a lot of people when they read about FODMAP, they'll see this list of these are red flagged foods and these are okay to eat. But is there, for example, that you can eat a couple of the FODMAPs on the red list during the day, but if you go overboard, you'll then have the symptoms, or how do you go about it?
Well, if you're very inflamed and starting out, you need to be super strict and avoid all of it at first. And then you can slowly introduce a little bit every other day or something to find out what your reaction is to that, and give it 48 hours, because sometimes if you have slow gut motility, you may not notice it right away. So it's kind of like any type of elimination diet where you get really strict, you take everything out, and then you slowly go, okay, I'm going to try almonds today. Is that an issue or not really an issue? Give it 48 hours. Okay. That wasn't bad. Maybe every other day I can have almonds or whatnot. For me, like I said, wheat's not a problem for me. So I don't eat a lot of wheat. I mean, I don't eat a lot of bread or pasta or anything like that. But if I do have it, I don't have major issues per se. You kind of learn which ones are really bad and which ones are okay. So, but you have to like you find the list, you got to get it out. There's still a lot of foods you can eat. I mean, that's what people don't understand is that there's still so many options. Like, you're not eating apples, but bananas and oranges, those are great. You may not be eating almonds, but you got walnuts, you got pistachios, you got pecans that you can still eat. So there's still and even peanuts are fine, and peanut butter, so people think like, oh, I can't have this, but they still can look at the list of all the stuff they can have, and there is a lot to still have.
Mm-hmm. Yeah, exactly. I think also one of the misconceptions when it comes to FODMAP is the elimination of gluten, because a lot of the high FODMAP foods are do contain gluten, but gluten doesn't actually seem to be the real issue, because you still can.
It's not a carb.
Yeah, exactly.
Right.
So because you can still eat spelt bread, and spelt does have gluten, and there's some research on this as well, where they're actually tested. They controlled for the high FODMAP foods, eliminated those and kept the gluten in, and still the patients were fine. So it clearly showed that the gluten wasn't the issue, but it was more related to the high FODMAP foods.
Right.
So could you just guide us through how you would work with the client that has IBS from the beginning, and how you would start the eliminating phase and then the including the foods back in as soon as they improve?
It's a huge education piece. It's so a lot of people know about nutrition. I had this one girl that I started working with. She just didn't get it. Like every day she'd be like, "Oh, I still am having issues." I'm like, "What did you eat?" "Oh, I just ate almonds." And I was like, "Well, that's not on." "Well, you said that some nuts are okay." "Okay." Or she would eat a protein bar, and I was like, "No." Like, so it's a process to educate a lot of people on nutrition. Like, they're not like you and I who have gone to school or even have any interest in it. They're like, they have like zero knowledge of food in general. So it's a huge education piece. We give all the lists. I try to give them all the lists and tell them why and what's there, show them all the stuff they should eat, and then follow them at least for a week with a food diary where they write down everything they're eating, and then I go, okay, that works. This is probably what set you off. Make sure that this bar had alcohol sugars in it. You didn't realize it. "Oh, I thought it was okay because it was all natural." "No, okay." Or that bar has this in it, or this food had onions in it. Like they had maybe they ate some sort of soup and it had an onion base. That could be throwing you off. So trying to educate them. So taking time, but being patient, because like I said, they didn't go to school like you and I did. They don't have an interest in it. So they don't even understand what a protein is and a carbohydrate is in general, which is also slightly scary. Like my one client, she said, "Oh, I ate oatmeal for breakfast, that has protein in it." And I was like, "No." Not really. Not at all. So, just taking some time and just educating. It's a huge educational piece until it becomes a habit for them. And then, getting them to get that smartphone app can help them see more information, or follow along on their computer, that kind of thing.
Yeah, excellent. And I think also the thing that people really find frustrating when they are eating certain foods is that a lot of the FODMAP foods actually are termed healthy. Like, for example, you talked about the apple, because some of the recommendations you get sometime if you have GI problem is just, oh, you need to eat healthy, you just need to eat more fiber, for example. And a lot of the food that they start eating are high FODMAP foods. So
fibers.
So what I experience sometimes with clients is that it's hard for them to define what's causing the issues, because sometimes they'll eat something for lunch, and then if it has high FODMAP in it, they'll eat something for dinner later, and then they'll get the symptoms. And they're like, "I don't understand. This is supposed to be something safe, but it's maybe something you ate early in the day."
Right. Like, that's why I said 48 hours of assessment, and then look what happened in the last 48 hours, or once you've eliminated everything, because it takes some time to show up.
Exactly.
Yeah.
So are there any supplements that might be beneficial for IBS?
Yeah, so I mean, there's digestive enzymes out there, which I personally never had any benefit of digestive enzymes because if I was still eating the foods that were irritating, it didn't matter what those digestive enzymes did.
Hmm.
You know, um, dairy is an issue, but it's summer and we all like to eat a little bit of ice cream. So maybe the lactate, where you get the lactase enzyme, that enzyme maybe can help be a little helpful if you have just a little bit of dairy, I guess. So I like when I take my daughter for ice cream, and of course I have to have a little. I
Yeah.
mean, that's has to happen. So I just have the lactate with me, and that seems to help a lot. Probiotics, it's hit or miss with probiotics. It depends on what strains you get, how viable those things are. I don't know. I mean, I've talked to a lot of different people, and probiotics have done nothing, and then maybe they make the gut a little calmer. There's a beneficial yeast out there called Saccharomyces boulardii, and that one I've read a lot about because it'll actually colonize in the gut, where some probiotics, they just kind of go right through you. So I still take probiotics, and I take that Saccharomyces boulardii because there's other benefits, like as a woman, like avoiding yeast infections, or it does have some immune benefit, but it may not necessarily be super helpful for my gut. There's betaine HCl, hydrochloric acid, which some people say helps with digestion, because we have low stomach acid because of the foods we eat. If my gut's irritated, I'll have some of that. I think a big one for IBS, which is really helpful, is actually activated charcoal. Activated charcoal will absorb the gas and the irritating foods and help get it out of the body. So I'll use that a lot if I go out and I eat something I know that's not all that great and then I've got some issues from it, I'll take the activated charcoal and it helps. There's other gut supplements like that have glutamine in them and marshmallow and these like kind of herbs that like certain companies put together that I've tried in the past, never really helped too much. Again, the biggest thing is really the diet. Like if you're eating stuff that's irritating, no supplement seems to really help too much. I mean, you can maybe suck up the gas with the charcoal or, absorb some of the water so you don't have diarrhea with the charcoal, but you're not really solving the problem. You're just kind of maybe masking a little bit of the symptoms sometimes.
Yeah, exactly. And I think that's really important to mention that because a lot of people, they start to have symptoms from their GI system and they just go out and buy a probiotic or they buy a supplement that's supposed to help them. But if you don't really dig into it and really find the cause of the symptoms, it's not really gonna help that much. Especially when it comes to probiotics, is my experience is that it's really individual. Like I mentioned to you, I did my thesis on probiotics and IBS, and basically what I found is that it's really individual. Some people seem to get a benefit from it, some people don't. And what I found was that those with constipation seems to have more benefits from it compared to those that has diarrhea. So it really depends on their own gut, and what strains you actually use. So it's like you said, it's a trial and mix, a trial and hit, and see if it actually benefits you.
Yeah, and I mean, there's stool testing. I mean, I've done a lot of different stool testings personally myself, and they'll go through and they'll test what bacteria you have in you, and they'll say, like, you need this one specifically, and I've done that in the past. And again, that still never really helped until I got the diet piece in order. So, I mean, I've been pretty good once, personally myself, once I've got the diet in order. But I mean, I could do another stool testing if you can get really specific with it, just like blood testing, like, find out, are you low in this vitamin or that, this, that, or the other thing. So you can do stool testing to find out like which bacteria specifically you should add back into your body. And some people feel that that's more beneficial. And I'm not saying yay or nay to that, but that may be more beneficial than just taking something off the shelf without any really knowledge of, do you really need that? Like, are you high in acidophilus? Are you high in bifidobacteria? And if you're low in one of them, you take that one specifically versus the other one.
Exactly. So just a follow-up question in regards to dairy, because some people seem to, like when we're talking about FODMAP, we're talking about the lactose that's in the milk that seems to cause the problem. But some people sometimes say that, well, I react to cheese as well, like white cheese, and white cheese doesn't have lactose in it.
Right.
So,
Right. I mean,
what?
dairy just in general can be super irritating. It is for me. I don't drink any milk. When I was pregnant with my daughter, I didn't eat any dairy, and actually, I've taken whey protein out of my diet as well, and I use pea protein. And I do so much better with not having the whey in my diet. And I mean, there's no lactose in whey.
No.
Very little. I use an isolate, so it's like super filtered. But I don't, and I would even use a natural whey. So I just stay away from dairy stuff, like I said, other than like ice cream, like and frozen yogurt.
Yeah.
Just a little.
Yeah, just a little sometimes.
It's good.
Yeah. The strategy that I use is just tell people that when you start a FODMAP diet, just eliminate lactose-based dairy products at first. And if you still are feeling that you're getting symptoms when you ingest dairy, that's when you might want to eliminate those as well. So
and they get confused too because they're told like eat yogurt because of the probiotics in yogurt and the live bacteria, but that can make them really bloated too. So or have diarrhea. So they have to get that out too.
Yeah, exactly.
Yeah.
So how many like what's the data on FODMAP and treating IBS? So how effective does it seem to be?
I mean, I haven't read specific numbers or population data, but I can just tell you that I mean it's gone crazy. I mean, like there are people talking about it everywhere, and it's so popular. Like I said, books coming out. There's cookbooks. There's specific people that their whole business is just on FODMAPs. Like there's a lady. God, where is she again? I don't know I think her website's like IBS Free at Last or something. And there's so many of them out there nowadays. And I get contacted by people all the time. Oh, I did this cookbook. I did this. I did that. And yeah, I mean, it's crazy. There's so much out there. So I would say that the success rate is very, very good for people, and it wouldn't be as popular as it is. And it's just growing in popularity. It's not weaning off. Like this is a topic that we started talking about 2008, 2007, and it's just been growing because it really works. So I don't know if we have exact numbers because there's so many people that don't need to go to their doctor to, report on this. So I would just say that it's helping a lot of people. Yeah.
I think there's one review that I've seen personally from 2013. I think the author is Barrett.
Okay.
That reported 85% improvements in symptoms for people with IBS when they switch over to FODMAP. But like you said, I think maybe the number is even higher.
Yeah.
Yeah.
Yeah. When they're doing it right.
Yeah, exactly.
Because there still can be like the problems like you don't understand. Oh, I wasn't supposed to eat onions. Yeah.
Yeah, exactly. So because some people that I work with is they can eat a lot of the high FODMAP foods, but there's really like the apple and the onions that really triggers them. Like everything else is fine, but onions and apples, it's just gives them symptoms right away.
Yep. Oh yeah. Garlic. Garlic is in there
garlic
too.
as well.
Yeah.
Okay, Cassandra, thank you so much for agreeing to do this podcast with me. Where can people find more information about you?
Well, I have a normal Facebook page like everyone else, and I post things on there. I write for Girls Gone Strong, so there's information there. I have my website, CassandraForsythe.com. That's got my bio and information. I don't really blog anymore, but there's all my old blogs on there about FODMAPs and fit pregnancies and things like that. I'm on different podcasts, and I've got the books out there that I've written. So, and I'm always accessible. You can contact me through my website on email if you need to reach out and ask any questions, and I answer pretty much everyone who sends me an email. So, I'm available.
Great. Okay, guys, that was all for this episode. This podcast will be available on my YouTube channel, but you can also listen to it in audio format on iTunes if you prefer that. So Cassandra, once again, thank you so much for doing this podcast, and have a really nice day.
Thank you.
Bye.
Bye.